right. So we're going to dive into something that's really got people talking assisted dying in the UK.
Yeah.
Parliament just voted on this bill to maybe legalize it for terminally ill adults
Mm.
in England and Wales. And it's pretty intense. I mean, we
Yeah.
found some pretty heated discussions online, especially on Reddit.
Oh, yeah. Reddit.
So many people are sharing, personal stories and really strong opinions on this bill.
It's a big one, for sure. I think what's really interesting about this bill
Yeah.
is that it kind of forces us to confront like some really
Oh, yeah.
deep questions about how we approach death and dying as a society, you know?
Absolutely. And that's what we're going to do today. We're going to break down like the core arguments,
Yeah.
both for and against this bill. We'll look at the proposed safeguards,
Okay.
tackle some of the common misconceptions, and hopefully help you navigate this whole complex issue.
Sounds good.
So you ready to get started?
Let's jump in.
Okay, so first things first, what exactly does this bill propose?
Well, basically, it would give adults who have a terminal illness
Okay.
and a prognosis of less than 6 months to live the option to request medical assistance to end their lives.
So it's not just like anyone who wants to end their
Yeah.
life. There's very specific criteria here.
Yeah, very specific. It's not just, open to everyone. There's a lot of criteria that needs to be met, and also a lot of safeguards built into this bill.
Okay, so safeguards. What kind of safeguards are we talking about?
Well, for instance, it requires approval from 2 doctors,
Wow.
a high court judge, and also confirmation that the patient is mentally competent
Right.
and that they're making this decision without any pressure from anyone.
That's a lot of checks and balances.
It is.
What are some of the main arguments in favor of this bill that you've come across?
Well, reading through those Reddit threads, I'd say a lot of people are motivated by compassion.
Yeah.
They've seen loved ones suffer, at the end of life.
Yeah.
And they believe this bill could offer a more humane option.
Yeah. I mean, there were some really powerful stories, right?
Yeah, absolutely.
The one that really stuck with me was about this man who was dying of bile duct cancer
Right.
and, spent his final hours vomiting fecal matter.
Oh, God.
And his wife was just traumatized. And the user argued that, assisted dying
Yeah.
could have prevented that suffering.
That's one of the big arguments, right, is that for terminally ill patients sometimes, the choice isn't really between life and death. It's between, like,
Yeah.
a potentially really agonizing death
Yeah.
and a peaceful one on their own terms.
There was this quote that really resonated with me. I have to say, it kind of shocked me, too.
Okay.
It said, "We treat our dogs with more compassion than we do with people when we decide that the dogs are too far gone
Wow.
and allow the vet to put them down."
Huh.
Like, do you think there's any validity to that comparison?
It's definitely provocative, and I think it raises questions about whether our own, discomfort with death and suffering might lead us to deny humans a level of compassion that we're actually pretty okay with extending to animals.
That's a really good point. It makes
Right.
you think about our values and priorities in a different light.
For sure.
Now, some people also drew comparisons between assisted dying
Yeah.
and do not resuscitate orders,
Mm-hmm.
arguing that, they both involve medical decisions
Yeah.
at the end of life. What are your thoughts on that?
Well, I think the comparison is interesting because it shows that we already accept some degree
Okay.
of medical intervention in the dying process, right? DNR orders give individuals a say in how they want their final moments to unfold.
Yeah.
And assisted dying, in a way, kind of extends that concept of autonomy.
Okay. That makes sense.
Yeah,
But of course, there's another side to this debate,
of course.
the arguments against assisted dying.
Mm-hmm.
What are some of the key concerns that you saw?
So one of the biggest fears that came up over and over was the slippery slope argument. People are worried that if we legalize assisted dying for terminally ill patients, it could then expand to people with chronic but non-terminal conditions,
Right.
or even to situations where individuals might feel pressured to choose death.
Right. Like that case in Canada where an Army veteran seeking help for PTSD
Yes.
received an assisted suicide advertisement.
Very concerning.
Really concerning.
Yeah, those kinds of incidents raise really important questions about whether
Yeah.
vulnerable individuals might be steered towards assisted dying
Right.
instead of getting the care and support they need.
And there were also concerns about the NHS,
Oh, yeah, big time.
like how it might handle such a sensitive issue.
Yeah, there was one comment that mentioned that the BBC was already talking about potential cost savings from assisted dying
Wow.
right after the vote,
Really?
which, Even though it's just one comment, it does reflect, I think,
Yeah.
a broader anxiety that a strained healthcare system
Right.
could end up prioritizing cost-cutting over patient care
Yeah.
and potentially lead to vulnerable people being subtly nudged towards assisted dying. And actually, this concern about the current healthcare system
Hmm.
and a lack of safeguards against coercion, it's not just like random people on Reddit. It's,
Yeah.
even prominent figures like Jeremy Corbyn have said that he's expressed concerns that people might choose assisted dying simply because
Wow.
they're not getting adequate care.
So it's not just about the bill itself, but also about the context in which it would be implemented.
The whole system.
Some people felt very strongly that instead of legalizing assisted dying,
Right.
we should focus on improving palliative care.
That's the other side of it, right?
Yeah.
That we should prioritize making death as comfortable as possible
Yeah.
rather than offering a way to hasten it.
It seems like there are really valid points on both sides of this.
Absolutely.
Before we go any further, though, can we just debunk some of those common misconceptions
Yeah, let's do it.
that came up in those Reddit threads?
Okay.
One that I saw a lot was that people with dementia would be eligible
For assisted dying under this bill.
So that's not true at all. The bill specifically requires mental capacity to make this decision. So anyone with advanced dementia
Got it.
would not be eligible.
Okay. Good to clarify. There were also some comments suggesting that this bill
Yeah.
is somehow about eugenics.
Right.
Or targeting people with disabilities.
That's completely false.
Uh-huh.
I mean, this bill is focused entirely
Okay.
on giving terminally ill adults autonomy over their final days. It has nothing to do with eugenics
Okay.
or targeting certain groups.
Hmm.
And it's really important to remember that the
Yeah.
proposed process has all these checks and balances specifically
Right.
designed to prevent any kind of abuse or coercion.
I think that's really important to get out there and dispel those myths and,
Yeah.
and focus on the facts. Speaking of things that need to be discussed openly,
Okay.
what role did religion play in this whole debate?
Well, religion was definitely a factor. Some MPs
Right.
opposed the bill, on religious grounds.
Yeah. And some Reddit users were frustrated that those MPs didn't always explicitly state their religious beliefs.
Interesting.
They kind of talked around it instead.
Yeah, that's a good point. I mean,
Yeah.
transparency is so crucial
It is.
in a debate like this, and it kind of raises a bigger question
Yeah.
about how religious beliefs should influence legislation
Right.
in a secular society.
It's a question we all need to think about, especially in
Yeah.
a diverse and pluralistic society like the UK.
Okay, so we've covered a lot already, the core of the bill,
Yeah.
the arguments for and against
Mm.
some of the misconceptions, even the role of religion. But this is a
Yeah.
global conversation, right?
It is.
What about other countries
Yeah.
that have already legalized assisted dying?
Yeah.
What can we learn from them?
I think it's really important to look at other countries.
Okay.
Canada, for example, has faced a lot of criticism for expanding assisted dying
Oh, really?
to people with mental health conditions. And there have also been allegations of coercion.
So it sounds like while other countries can offer valuable lessons,
Yeah.
we also need to, chart our own path,
Yeah.
considering our own unique
For sure.
social and cultural context.
Each country's got to kind of grapple with these issues and find solutions that
Yeah.
align with their values and priorities.
One final thought before we move on to the next part of our deep dive.
Okay.
Public opinion polls show strong support for assisted dying in the UK.
They do.
But there's a twist.
There's a twist.
Public support seems to drop significantly when people are given more detailed information
Interesting.
about assisted dying and how it's been implemented in other countries.
So that's really fascinating, isn't it? I mean, is it just that the public doesn't
Yeah,
fully understand the complexities, or are there deeper concerns there?
that's the million-dollar question.
It is. I think it could be a combination of both.
Yeah.
Maybe the initial support is driven by compassion,
Uh-huh.
but as people learn more about the potential risks and challenges, they start to hesitate.
This is all so fascinating, and we've barely even scratched the surface.
Ooh, I haven't.
I mean, we've explored some of the key arguments
Mhm.
and the emotional complexities, but there's just so much more to unpack.
There is. In the next part of our deep dive, we're going to go deeper into the nuances of this debate
Okay.
and really delve into the potential consequences of legalization.
Stay tuned, because things are about to get even more interesting.
Yeah.
Welcome back. We're continuing our deep dive into assisted dying in the UK.
Picking up right where we left off, exploring public opinion and all the nuances.
Yeah, we were just talking about how that public support for assisted dying seems to shift when people learn more about the specifics.
It's fascinating, right? Like that shift.
It is.
Yeah.
So let's dive back into those Reddit threads.
Okay.
And see what other concerns people were raising.
Yeah, one thread that really stood out to me was the one about potential abuse within families.
Oh, wow. Yeah.
That's a difficult topic.
It is, but it's an important one.
Yeah, for sure.
So you're talking about like situations where someone might feel pressured by their family to choose assisted dying.
Exactly.
Maybe because they're seen as a burden.
Right. Maybe because of inheritance or the responsibilities of caregiving. I mean, there are lots of reasons.
There was a really sad story from one user who talked about their 97-year-old grandmother.
Oh, gosh.
She was immobile, suffering from multiple cancers.
Wow.
And just desperately wanted to die.
But under the current terms of the bill, she wouldn't be eligible for assisted dying because her conditions weren't considered terminal.
Yeah, it has to be less than 6 months.
Exactly. She was expected to live longer than 6 months.
Right. And so the user felt that the bill was like offering this compassionate choice to some while leaving others like their grandmother to endure, prolonged suffering.
And it's a good point. It really highlights the challenges of trying to make a law that covers every situation.
You can't.
It's impossible.
Another user shared a story about their grandfather who died of bowel cancer after like a year of really grueling treatments. Yeah. And he refused to let his family see him. Wow. In his final days because he was so distressed by his loss of dignity.
That brings up another layer to this whole debate, right? The concept of dying with dignity.
Absolutely.
It's not just about physical suffering. Yeah. It's about having control over how and when we die. Right. Being able to preserve our sense of self.
So many users were saying that being forced to endure a prolonged and undignified death, it strips away that control and it robs people of their autonomy.
It does. And that idea of autonomy kept coming up over and over again in the discussion.
Right, like it's a human right.
Exactly, like a fundamental human right to make choices about our own bodies and lives, even if those choices involve death.
It reminds me of like the language used in the abortion rights movement. Yeah. My body, my choice.
Right, it's the question of who gets to decide about our lives and deaths.
But then, as with any right, there's the question of limitations and where other people's rights
exactly. And that's where those worries about coercion and abuse come back.
Right. It's such a difficult balance.
It is.
On one hand, you have, the individual's right to autonomy, but on the other, there's this need to protect vulnerable people.
Especially in a society that doesn't always have enough resources for the elderly and the disabled.
And then there were the anxieties about the NHS.
Oh, yes.
And whether it can even handle this responsibly.
People were saying things like, the NHS will not get this right. Yeah. Which, shows a lack of trust in the system's ability to handle something this sensitive.
And understandably so, right? Yeah. There's already so much pressure on the NHS.
Totally.
That people are worried about potential cost-cutting measures.
For sure.
It's a lot to ask.
It is.
Of a system that's already struggling.
Some users were pointing out that doctors already make life or death decisions, through DNR orders. Right. So they were saying this bill just kind of extends that power. Yeah. Gives patients more control.
But then others were saying, hold on.
Right.
There's a big difference between withdrawing treatment and actually giving someone a lethal dose of medication.
That's the heart of the moral debate, right?
Right. It forces us to think about the role of medical professionals and the limits of medical intervention.
And what about the impact on those healthcare professionals?
Oh, yeah.
Can you imagine the emotional toll?
That's a good point.
Of participating in these procedures?
Right. Like, are we prepared as a society?
The question.
To deal with all of this?
The ethical and emotional complexities.
It's a lot.
It's a lot to consider.
Before we move on to the last part of our deep dive, I want to shift gears a little and talk about how other countries are dealing with this. We talked about Canada, but what about the Netherlands?
Oh, the Netherlands, they were pioneers.
They were
this whole thing.
What can we learn from them?
Well, they've been doing this for over 20 years now.
Wow.
And their approach has changed over time.
Okay.
They've had a lot of the same challenges and concerns that we're seeing here in the UK.
Right.
But they've also developed ways of protecting patients.
Okay.
And making sure things are done ethically.
So their experience could be helpful for us.
Yeah, they could be a great resource.
And there are other countries too, right?
Oh, yeah, like Belgium, Switzerland.
Well, right. We're not alone in this.
Definitely not.
By looking at what other countries are doing, we can learn about the potential benefits and risks.
Exactly. It's about learning from each other.
Yeah.
And finding the best way forward.
It seems like we've covered a lot in this part.
We have.
We've talked about personal stories,
Yeah.
the ethical considerations, and even what's happening in other countries.
But there's one really important thing we haven't talked about yet.
What's that?
The actual details of the bill itself.
Oh, yeah, the nitty-gritty.
The nitty-gritty.
How would it actually work?
Exactly. We need to understand the legal and procedural details.
So join us for the last part of our deep dive.
Yes.
Where we'll break down those legal complexities.
We'll get into all that.
And look at the potential implications.
It's going to be good.
It's going to be a fascinating conclusion
Jesus.
to our exploration of assisted dying in the UK. Okay, so welcome back to our deep dive into assisted dying in the UK. We've talked about the emotional arguments, the ethical considerations, and even what's happening in other countries.
And now it's time to get into the nitty-gritty.
Yeah, like how would this bill actually work in practice?
Exactly.
So let's say this bill becomes law. What's the process for someone who's considering assisted dying?
Well, first off, it's really important to remember that the bill is super specific about who's even eligible.
Right, not just anyone can request this. We talked about some of those criteria earlier.
Did you have to be an adult over 18, living in England or Wales, registered with a GP for at least 12 months?
Okay.
And you have to have a terminal illness
Right.
and a prognosis of less than 6 months to live.
So we're talking about people who are really in the final stages of a life-limiting illness.
Yeah, and it's not just one doctor's opinion.
Right, it has to be
By 2 independent doctors.
Wow.
And of course, the person has to be mentally competent to make this decision.
Right.
They have to understand what it means, and there can't be any pressure or coercion.
That mental capacity piece is something we've talked about a lot.
It's huge, and to make sure that's really happening, the person has to have a mental capacity assessment done by a professional.
So someone meets all those criteria, then...
Well, then those safeguards we talked about really kick in.
Okay.
The person has to make 2 separate declarations
Okay.
in writing, witnessed and signed.
So it's not a spur-of-the-moment thing?
No, not at all. They have to be really sure this is what they want.
Got it.
And there's a waiting period, too.
Oh, really? How long?
At least 7 days between those 2 declarations.
Okay.
So they have time to think it over.
Makes sense.
And they can change their mind at any point.
Okay, so what about the High Court? We mentioned that before.
That's a key part of this whole thing.
Okay.
A High Court judge actually has to review and approve every single request.
Wow, that's serious.
Yeah, it's a big deal. The judge is like a final safeguard, against potential abuse or coercion.
Makes sense.
They have to be totally satisfied that everything's been done properly.
Yeah.
And that the person's decision is really genuine.
So once the judge gives the... okay, then what happens?
Well, then the assisted dying can be carried out.
Okay, and what does that look like? What's the procedure?
The bill gives some flexibility in terms of the method, but it's gotta be peaceful and dignified.
Okay.
One option could be like a lethal injection given by a doctor.
Is self-administration an option under this bill?
That's something that would need to be figured out,
Right.
But it's something that other countries have done.
Okay.
But obviously there'd have to be strict rules around that.
Yeah, for sure, to prevent any kind of misuse.
Exactly.
As we wrap up, I want to go back to something we talked about before.
Okay.
The fact that this bill could change over time.
That's a really important point. Laws like this, they're not set in stone.
Right.
We're going to learn things as we go.
Right.
And there will probably be changes and revisions down the road.
So it's important to keep talking about this even after the bill passes.
Exactly. Keep learning. Keep adapting.
It's been a really interesting journey exploring this topic.
It has.
I feel like we've all learned a lot.
I hope this deep dive has given you a better understanding of what's going on.
Yeah, we've covered so much.
The arguments, the ethical concerns, even the legal details.
But more importantly, we hope this encourages you to keep thinking about this issue.
Yeah, and form your own opinions.
Thanks for joining us on this deep dive.
It's been a pleasure.
We'll see you next time.